My name is Connie Marks-Miller. I'm a nurse in cardiac rehab and I coordinate our program. Here in cardiac rehab, we have an amazing program where we work with folks who've had major heart events, and they come together to educate and to exercise. It's a guided program working with their physician to then help them get back into life. We have an exercise specialist that helps guide them on how to use the equipment progressively but safely, and then I, as the nurse, watch their heart on the monitor. And 36 visits, we come together. Where else in the health field do you get to spend that much time with an individual, helping them on the journey of good health? Heart disease is rampant, but when you know your risk factors, you can make a difference. In cardiac rehab, we work with folks who've had the following heart needs. They've had a heart attack or stable chest pain. They've had bypass surgery, heart transplants. They've had stents placed in their coronary arteries. The list goes on. And they come to us willing to live. And in doing so, we're able to educate and exercise them in a realm like no other. Those diagnoses are pretty scary, but when you begin to understand what has happened to you and the difference that you can make, cardiac rehab teams up and off we go. Little by little, we have a saying in cardiac rehab, in order to strengthen and gain that endurance, it's like eating an elephant, one little bite at a time. And we push hard in cardiac rehab, but in small increments, so that by the time you're done with 36 visits, or however many it takes to then gain that strength, you feel confident to then go out and live life to the best that you can. Here in cardiac rehab, folks come in from all walks of life, all levels of fitness. They come in fairly scared. They've had a lot happen to them. And the staff work to help them in gaining courage and strength. And a lot of the comments we hear is that, oh, this patient had something similar happen to them as to me, and look at how well they're doing, and they feel the confidence from the other folks that are in the program. By the time they're done, their courage and strength has gained to where they can go on to exercise, and that is really our goal. Yes, we want them to understand what has happened to them, but the key here is exercise. They've got the education, and to continue to exercise. We often will say it's like boot camp. We're in training to then help them be successful, to continue a lifelong ability to exercise, because that's going to help them with all the risk factors that they have been challenged with. And so here in cardiac rehab, it's such a pleasure to work with them, to see the changes in confidence and in strength and in health. And in doing so, as a clinician, it's just amazing to watch and very rewarding to see their progress and success.
My name's Craig Palmtag, and I had cardiac surgery. This program has definitely helped me. I feel much better. I feel I'm able to do right now much more than what I did before the surgery, and I'm looking forward to hunting season this year so I can start chasing elk again. The ladies here, Connie and Shelly, are just the greatest nurses that are here to push you, they watch you, and if anything is going wrong, they stop you, make you rest. And I would recommend this program highly to anybody that's had any type of heart surgery.
So oftentimes here in cardiac rehab, we ask patients, how did you hear about cardiac rehab? So they've heard about this thing called cardiac rehab. Not too sure about it, but you know, that nurse said it would be a good thing to do. And so they get home, they get through that magic threshold of home, and they have that first doctor's visit for follow-up, and they say, what about cardiac rehab? And so they then work with their physician to then refer to cardiac rehab. Once we get that referral, we're giving them a call, explaining about the program more, seeing if it's a good fit for their needs, and then they come in, they have an interview, they learn more about us, we learn more about them, and off we go. Now, oftentimes you can get that referral from your cardiologist. Now, it doesn't require that. It can also come from your primary care physician, and that's an important note because our primary care physicians often will then take the time to make sure that all those different components of life needs are met. So there's a lot of folks in our community with what's called heart failure. Heart failure comes in two different forms, systolic and diastolic. That's a word that you've heard in the past, heart failure, or something that you might have. Please feel free to contact us here at Lodi Health, and we'll be glad to go over that information with you. Here in our community, we have an awesome support group. The name of it is The Beat Goes On. And here in this support group, folks who have an interest in knowing more about heart health don't have to have a heart need, but if you want to know more about heart health and be around people who enjoy learning, The Beat Goes On is a great support group. It meets at our West Campus here at Lodi Health, and it's the first Tuesday of every month at 11 o'clock. And we have a nice small group that gets together, checking in with each other, learning about things in the community that will help them with their health, as well as good speakers that they can glean information from to then live well.